Mental health in Iraq is still a stigma. There are many people who don't want to talk about or even refuse to admit to. Many IDPs, returnees, or even people who suffered during the ISIL time, they deny or they refuse to have access to the treatment in fear of stigma. We need more people to talk about. We need to break that culture of stigma and shaming culture. It is very natural to seek help from mental health, exactly like a physical pain. And so it should be to seek help. Maybe if I go to a mental treatment, people will think I'm crazy. Maybe it has psychological effect on me and people might not receive me correctly. And probably sometimes when I'm from a family where people think, okay, there is one person who is going to the mental treatment, then it means he could be not normal.
The many political crises in Iraq, made by wars, violence, and conflict, left many people with mental health disorder. After the conflict with ISIL, Mosul reported the highest percentage of post-traumatic stress disorder. Less than 10% of the children in need of care had received any level of treatment. If I'm stressed and I have a lot of pressure, I cannot focus on my family and I feel very negative, and maybe I will take like negative decision against my family, myself, and the society. Mental health services, it's important because we talk with people. Once people will talk and release the stress, this is the first stage. Then the second stage is how to deal with the stress and how to give support from many sides to the people.
Mental health services in Iraq is still well below the standards around the world and is greatly insufficient and incapable of meeting the increasing need among the society. There are a very few number of trained psychologists or psychological counselors, and the number of psychiatrists available is not enough to meet the growing need among the society. Okay, I also think like with increased access to mental health services, we would work around issues that have arisen due to years of conflict. You see, societies are very divided, and you would see Iraqi families untrusting of their neighbors. And I think with more increased access to these services, the people would be able to deal with these issues.
Armed conflicts in Iraq causes significant psychological and social sufferings to the most vulnerable population. And World Vision have been supporting, and our support has been aiming to protect and promote psychological well-being of those people and prevent or treat the mental disorders. Specifically with the help of the government of Germany, we have a long-duration mental health and psychosocial project in Mosul, covering both sides of the city. So initially we have identified and recruited staffers and also engaging them with the voluntary activities so that they understand the local cultures. And also through this project we have partnered with the 2 local NGOs for the better implementation. So our health services mainly have been specific psychological and social consideration in provision of general health care, also providing access to the care for people with the severe mental disorders, in addition to minimizing the harm related to substance abuses. In terms of results, so far we have benefited around 10,253 people through our provision of psychological first aid, problem management plus, children play therapy, medical treatment, individual sessions like psychological cases, campaigning on mental health, also case management, MHPSA services. Fortunately, the mental health psychosocial services during the emergencies usually are neglected. So these services are coming after some other services, but those are essential health services that we have to address. But if we don't, unfortunately, the impact is huge on individuals, but also on the community, because there will be the burden that we are losing a valuable member in the community, and it will be a burden on the family, but also on the community. In addition to the urgent needs that we have been responding as World Vision, it is also equally essential that we take care into the mental health well-being of those vulnerable populations. So this means as well as the education and the basic health services, we have to take into consideration in our programming special attention to the mental health needed of those people, especially when we are talking about the development and resilience recovery phases in these areas. So if we want to have longer during programs and also impact an improvement of their health status for those people, we definitely should consider their mental health well-being in our programs.